Welcome back to our Bluesy Water channel. We recently got in a very high-end p.e.m.f system. I'm going to do some demo videos in this video to show you how to use it, but I just want to briefly review what it is. So first of all, let me share the screen. Okay, so this is what's called a inverse square law calculator. So why this? The reason one wants to buy a very strong p.e.m.f system is due to this law. So simply put, wherever you're applying the magnetic field, the starting power needs to be strong enough so that when it goes 5 or 6 inches into the body, it's still staying strong enough. But every inch it goes down, it reduces quite a bit. So this calculator actually can help you calculate 5 inches into the body. So we explain that if you start at 10,000 and just go in 1 inch, it reduces to 2,500 gauss. The bottom line is this system is extremely strong and has the firepower to treat deep in the body. Why is this important? Because number one, you can get to areas that normally you can't get to, and number two, the treatment time goes down tremendously. So I gave some examples, one for the brain. And there was an area in my brain, it might have been an old injury, I'm not quite sure, but I could never get to it, even with all the treatment modalities I was using. And within 5 or 6 treatments, I had accessed this area deep in the parietal region. And the MRI, by the way, showed that there was something going on there. And I'm sure if I got one now, it would be either gone or tremendously reduced. As a body worker, I'm very self-aware of my own body, so I knew exactly where the MRI would show up, and it did. But this is a really very, very profound second testimonial. I played a lot of tennis, and then I tried it again recently, and then I was kind of okay, but 3 weeks later, I was crippled in my knee. Now, as a body worker, I understand when anybody comes in, I'm scanning the whole body, and I'm able to do that on a client. But with myself, I was never able to do that. I didn't have that superpositional point of view. So when the machine showed up about the time my knee was in crisis, I've had this happen before. And so as soon as I started treating that left leg, I started scanning my whole leg, and there was probably 5 or 6 areas that were old injury sites that never really fully resolved. Well, this device just revealed every old injury. It literally is like a scanner. So if you scan your whole body, you're going to find things that you think you're fine, you're going to find all kinds of stuff. So once I treated, and here's the beautiful part, once I treated, like there was a place on my shin bone, spleen, stomach, meridian points, that bone related to old Achilles injury, there was IT band and quadriceps. And then the treatment time was so fast that the leg cleared very, very quickly, and the knee went totally calm. So my knee problem was really a whole leg problem. And this device will scan regionally. If you go up the leg, you'll find out what's wrong. Then you can focus on those areas. Up the arm, you'll find, oh, my shoulder. Let's say you have carpal tunnel. You have to scan up the whole arm, go to the shoulder area. A lot of times carpal tunnels, a lot of blockage and nerve flow at the shoulder. So you start to think like a body worker. You're going to really scan regional. If you have, let's say, SI, a sacroiliac joint, you want to scan the hips, the whole pelvic girdle, the lower lumbar. This is what I did as a body worker. I understood the relationships between a particular area that was hurting versus the pathways to it. Okay, so that's in essence why this is an extraordinary device. And this is an interesting blog, just explaining the relationship of acupuncture meridians to, I'm sorry, to connective tissue, and then the sort of subconscious patterns that drive the engine underneath all that. All right, so what I want to show you how this device works. These are videos for a similar like in kind device. They're all the same. The ones that use the loops are similar. It's just a question of how strong the system is and how much you're paying for it. So our system goes up to 24,700 gauss, and we're going to just show you how you would do a treatment. So let me pull that up. This is the smaller loops. They're called the butterfly loops. If you couple them together, you get double the power. And if you, or you can use them separate. So this is just a quick example of using the double loop. By the way, the double loop is used for more local areas like knees, elbows. You do it on the head. You're targeting a very small area. It's a small circumference. Ironically, even though a large loop won't run as powerful, it's such a huge area that it treats, you're going to feel it quite a bit more. So it's a bigger standing wave. This is a very tight treatment focus. So even though you can crank the power up higher, but especially if you're on bone, you're not going to get the big uh, reaction. But you got to, so that big loop you have to be careful with, and you always start low. Whenever you're treating, you start at a low power setting and feel your way into it. Be careful of endangerment sites, like you're not going to, if you go near the eyes, if you have metal in your teeth, for instance, like titanium, you got to be very careful. So always just sort of check it out, start low, start on the low. It goes from 1 to 10 hertz. The 10 hertz is going to be more aggressive treatment. So you want to start at 1, 2 hertz, low power intensity. You can increment by 10% on the power. You'll get to know it pretty quick. So again, I just want to show you some of the examples of how you can treat. This is the double loop. So she's tying them together just to anchor it. You can just hold it. If you're using them together, it's nice to use these ties to just keep them secure. Okay. And I mean, if you want to sit there and not hold on to it and treat for 5 minutes, that could work. Now, you don't see a lot of jumping in the body on these smaller loops. She's treating now. On the large loop, you can see things jump. So anyhow, this is just an example of treating the knee. So now she has two loops tied together. It's double the power. You could just put it directly on a shoulder joint, or you could use the big loop over the shoulder also. You go, and then she's showing how you could go either side bilaterally. So now it's each one has half the power, but they're working together. That's a good example. There's another example. So now she's using two loops together on the calf, or you can separate it. So this is a good, and if you want to sit there for 5 minutes, tie it up and just hang out. Large loop on the thigh, very simple. Not the system, by the way. Come in various controllers. Ours is more powerful than that one. There's a good example of treating the hip. If you're standing up, you could just rotate it all around the pelvic girdle, up through the butt, the sacrum. It's flexible, so you could just work it and scan the whole hip. This is the whole front of the body. You can do organs. You can do colon, small intestine, liver, gallbladder, pancreas, spleen, stomach. You could just move it around and just focus on various organ systems. Great example, treating the neck. You could also take the two butterfly loops and dial in, separate them and go either side of the vertebra and treat the neck. You can stick your leg in and just sweep up the thigh, the pelvic girdle, the sacrum. This is the whole back. Excellent example. This is the manual for our system. When you purchase our system, you get support. As a body worker, I will help assess you. I will help make sure you're using it properly. We'll do a Zoom call. We'll get at least a couple of sessions going till you feel comfortable. And you can ask me any questions regarding treatment approaches. I just want to say once again, this is extraordinary as a scanner alone. When you take that large loop and you scan your back, you scan your shoulders, you scan your up and down your legs with the butterfly loop, you're going to find out where stuff is. You say, I feel great. I found my sacrum was feeling fine. I started treating and my sacrum, it was all the old injury. So just because an injury isn't active, it can be suppressed. It can contribute to all kinds of imbalances. It blocks energy. If you have blockage in the sacrum, it's going to affect all the nerve flow down your leg. So if you think like a body worker, you would understand this, but this will make you think like a body worker because you'll realize, oh my God. And you don't even have to think very much. If the sacrum is hurting, treat it. Then the rest of your leg will feel better. And so you just acclimate to kind of blockage as just a matter of course until something screams. Then you go usually replace the hip or the knee rather than work on the areas that contributed to blockage. Now, there is a time, obviously, with very severe injury, like where, everything's just worn out, you might need a new knee. The problem does originate from a series of issues that contribute to the one. Now, here's another thing that's really extraordinary, and this is another principle you really need to understand. This goes at every cell, literally. If it has enough power to start, it'll go into the body and treat every cell. So I just want to go back here. Having treated many clients, I recognize the first obstacle was being able to get deep enough penetration. What makes this exceptional is not only is the gauss strength sufficient to permeate deeply, but remember, this is the key with p.e.m.f. p.e.m.f is like an MRI. Every cell is being treated. No stone unturned when doing this therapy. All muscles, ligaments, tendons, bones, nerve sheaths, blood, meridians, etc., are being treated at once. p.e.m.f, like an MRI, will ring every cell. But once again, you need enough initial magnetic field intensity to effectively treat 6 inches into the body. This is imperative to understand. I also, as I explained in that write-up, I do own another p.e.m.f system, a much more gentle p.e.m.f system, which is excellent for long-term use, for sleeping. So it's a nice, gentle flow, and you can adjust it sort of goes from what I call intermediate Gauss, 100 Gauss max, down to, you can dial it down to a half a Gauss. The most popular p.e.m.f in the market is a half a Gauss. That's just like creating a nice field to lie in. It's not treating heavy duty blockages deep in the body. This system is not to relax and lie on for, hours. It's even at the lowest setting, it's very intense. It's getting in deep. It's meant to treat and break up blockages and get to areas that you can't get to. Again, as a body worker, I understood this because I always felt that I needed to get in here, get in there. And I just didn't have the firepower to get to every cell. I've used vibrational tools and I've used vibration machines. I've used other therapies, light therapies, but this particular forte is, let's say you had an Achilles injury, it's going to go at every cell. It's hard to get to those cells on the Achilles tendon. And the treatment time is vastly reduced because of the power. So I have treated injuries with my other system, but you had to do long treatments. So p.e.m.f needs to be understood for what it is and understand the different types of, think of like a little toothpick versus a jackhammer. Toothpick has its place, jackhammer has its place. Unfortunately, with certain injury sites in the body, including like scar tissue, things get so dense, nothing gets to them. So you need something like percussive therapies that will break things up. The rapid release massage tool, for instance, was designed to break up scar tissue at the right frequency. But this device, very powerful. It's like a super jackhammer, and you can get to a lot of structures that need busting up. But also, it's not that crude. It actually will ring every cell. So it's microcellular. So even though it sounds intense, and it is, it's still actually causing cells to be exercised, more oxygen. So that needs to be appreciated also. So you just have to work with it to understand its power. All our tools, each has its place. The more you know them, the more it's just instinctive to what you use for what. For instance, if you have a big infection, you're not going to use this. It might help oxygenate. Let's say you had a lung infection, you put it on your lungs, might get more oxygen going, which would help for the infection, break up what the Chinese call the qi stagnation. But you would want to have preferably also some type of tool that goes after microbes. So we have those tools. So understand your tools, build a clinic, know what you're doing. And if you know your tools well and you become capable, then you can look at every issue and say, okay, what am I trying to do? What needs to occur? It's hard to self-assess, to be honest. Even sometimes I try to say, is it this, is it that? And then you also got the complexities of your own mind and what it's telling you, and that's not always the truth. So you got to learn to be a really good observer and interpreter at the same time. All right, I hope this helps. I hope you get an idea what this technology can do. Appreciate it. Thank you.